everyone. My name is Sania from the channel Dr. SNA, that is Dr. Sania and Amir. So today I am going to discuss with you a disease known as influenza, which is very commonly called swine flu. So let's start. Swine flu is caused by a fast mutating and a deadly subtype of influenza virus H1N1. Now, this virus is the cause of multiple outbreaks in various countries around the world. Therefore, there is a need for extra precaution amongst those who are vulnerable and they are exposed to this virus. So a little bit about the history of swine flu. After the 1930 flu pandemic, it was discovered that it was caused by the diseased pigs, which were infected with the influenza H1N1 virus. The years preceding to that, it has been discovered that there are various subtypes of this virus which are mutating at a very fast scale. Now, there are various outbreaks of influenza virus which have been documented in different countries and which has been leading to multiple deaths in those countries. These countries include USA, Philippines and Northern Ireland, and in most recent years Pakistan, India, Maldives and Nepal. Now let's talk about the clinical presentation of this disease. This disease causes various signs and symptoms such as fever with chills and body aches, sore throat, coughing, weight loss, loss of appetite, and many others. I have listed all of them over here. Now, what is important to understand over here is that the person infected with disease does get better in few days. But then why are there so many deaths due to this disease? The reason is that this disease causes some set of complications which leads to the death of a person. Now, what are these complications? One very common one is respiratory failure. In respiratory failure, the person might turn blue or the nails might turn blue. And the person might have air hunger. That means that he is breathing very rapidly, and also loss of consciousness, that the person has increased drowsiness or sleepiness. Another very common complication is dehydration and electrolyte imbalance. Now, dehydration and electrolyte imbalance could be due to diarrhea or vomiting, or could be due to that the person is not eating or drinking anything. Now, this is very common among the elderly patients. In which hyponatremia is very common. That means that the sodium level in the body goes down. So it is very important that during this disease the person takes ORS to replenish their minerals and their water as well. A very common complication is also pneumonia, which is the infection of the lungs. Now, in that, the person might have a very severe chest pain and high-grade fever with coughing and production of the sputum. So, another very common complication is renal failure, in which the kidney function decreases. Now, in that case, the person might develop overall body swelling and decrease urine output. Now, my point is not to scare you, but actually to make you more aware about this disease. So if somebody in your family or friends have this disease and become severely ill, then it's important to take that person to the hospital immediately so that he or she can be treated for the complication it has developed. Now, what we need to know about the preventive measures of swine flu. Number one, if there has been an outbreak in a certain area, then the governing body of that area needs to find out the source of the disease and contain it and take measures to decrease the spread of the disease. Secondly, there needs to be decreased transmission of the virus from the pigs to the humans. Now, how is that done? There should be regular monitoring of the pigs for diseases. Secondly, the humans who are in interaction with the pigs should wear disposable gloves and masks. And thirdly, the pigs and the humans should be vaccinated. Now, how to decrease human to human transfer of the disease? Number one, if somebody who is infected with disease, it is advisable and it is very much important that that person should avoid public places and decrease the interaction for at least 5 to 10 days to decrease the spread of the disease. Secondly, whenever you come from somewhere outside, it is important to to wash your hands and to use sanitizers before you touch your eyes, nose, or mouth. And especially the things which you use with other people, such as cell phones or remotes. It is very important to get yourself vaccinated for swine flu as well, and take important preventive measures to avoid the spread of the disease. I hope you guys found this video very informative. If you did, then please give this video a big thumbs up and leave your comment below to let us know about your suggestions. Follow us on Instagram, Facebook, and Twitter. And don't forget to subscribe to our YouTube channel, Dr. SNA. Thank you so much for watching.